So this is Khurram Nasir and you're watching Optometry with Khurram. And today's topic is actually the extension of the last lecture. And you know very well that our last lecture was about the anisometropia. In the last lecture, in the last video, we have discussed the detailed definition of anisometropia. And you know that the difference in refraction in the both eyes is called anisometropia, right? And we have also discussed about the different types of anisometropia. And this lecture is critically more important than the last one, right? So in this lecture, in this video, we are going to learn about the treatment and management of anisometropia and anisometropic amblyopia. You know very well that anisometropia is actually the difference in the refraction in the both eyes, right? And what is amblyopia? Amblyopia, in a very simple language, I must say, if you do not have any pathology, if you do not have any deformity, if you do not have any disorder, if you do not have any disease in your eye, all media is clear. There is no any cataract, there is no any retinopathy or something else, right? But slowly and progressively you are losing your visual acuity in one or the both eyes. Most of the time is uniocular. The amblyopia is uniocular, but in some cases the amblyopia is binocular as well, right? So what is amblyopia? If you do not have any abnormality in your eyes, but your eye is slowly and progressively losing its vision, right? And there is two line difference between the both eyes. That abnormality is called the amblyopia, which is very dangerous. So in this video we are going to learn about the treatment or management of anisometropia. If you develop anisometropia, if your one eye has different prescription and other eye has different prescription, right? So what would be the proper and appropriate treatment, mode of treatment in this situation, right? And if you got anisometropic amblyopia, right, if you develop amblyopia due to anisometropia, due to difference in refraction in the both eyes, so how can we manage that condition? How can we manage that specific situation or condition which is called anisometropia or anisometropic amblyopia? So let's learn about these two conditions and their treatment. So let's learn about the treatment, the mode of treatment of anisometropia, right? So anisometropia is the unequal refraction, you know very well, in the both eyes, right? So the anisometropia, the onset of the anisometropia or anisometropic amblyopia is at the age group of when you're dealing with the children, when you're dealing with the kids, right? Amblyopia is specifically started, the onset of the amblyopia is actually when you are a child, when you are a kid, right? So now we will discuss about that mode of treatment. For example, the age of the patient is 6 years, for example, right? And the prescription is +1 with 0.5 cylinder at 90 degree in both eyes. It's bilateral, right? Sorry, it's not bilateral. We are actually dealing with the anisometropia. So the left eye should be of different prescription. So in the prescription in the left eye is plus, you can say 3 with the same cylinder and the same axis. So this is for the right eye and this is for the left eye. Right eye got +1 with 0.5 cylinder at 90 degree and left eye got +3 spherical with 0.5 cylinder at 90 degree. So what will you do as an optometrist if you got this prescription? Will you prescribe the undercorrection? Will you prescribe the full correction, or will you prescribe the overcorrection, right? The age of the patient is 6 years, but the most important thing here is what is actually the visual acuity with this prescription. If a child of 6 years, this is actually a type of scenario. So the age of the patient is 6 years, the right eye prescription is this, the left eye prescription is this, right? And for example, the visual acuity in the right eye is 6/6, right? And for example, it is probably impossible, but for the sake of learning, if the visual acuity in the left eye is 6/6 as well, the monocular visual acuity with this prescription in the right eye is 6/6, and monocular visual acuity with this prescription is 6/6 as well, right? So what will we do? The problem is when we prescribe +1, we settled this prescription +1 with 0.5 cylinder at 90 degree in the right eye, and when the patient look at Snellen chart with only the right eye, monocular eye, right, the visual acuity of the patient is 6/6, and when he occluded his right eye and he see the Snellen chart with the left eye, the visual acuity is the same, 6/6, but when the occluder is removed, there is diplopia, there is symptomatic things, right, because the prescription in the both eye is not the same, or the difference between the prescription is very high. Right eye got +1 and left eye got +3. The visual acuity of the patient is 6/6 with the left and the right eye, but when he will see or she will see with the both eyes with prescriptions, he or she will feel diplopia or discomfort, right? So what should we do? So in this case, we will find the dominant eye. For example, how can we find the dominant eye? Remember that if a prescription is +1.5 90 degree, +3.5 90 degree, right? So the right eye got the least prescription because this is +1, right? And with the least prescription, the visual acuity is maximum. So this is the dominant eye, right? And we will prescribe maximum number or full correction in the dominant eye. And what is the dominant eye? The eye which got the least prescription with maximum visual acuity. That eye is dominant eye, right? So we will prescribe maximum prescription. And what about the left one? Left one has +3 with 0.5 cylinder at 90 degree and visual acuity is the same, 6/6, right? So we will, should we prescribe the full correction in the left eye or under correction, full correction or over correction? Remember that, look, if we can make two different blocks, one is power and other one is disparity. Disparity means actually the difference in the size of the retinal images. If one retina, you have two eyes, it means you have two retinae, right? One retina and two retina, one eye and two eyes. So if the image size on the retina are not the same, you will feel disparity or diplopia, right? So if there is anisometropia of just 0.25, the disparity or unequal image size on the retina will be 0.5%, right? And if there is difference of 0.50 diopters, the disparity will be of 1%, right? And if there is anisometropia or unequal refraction of 1 diopters, the disparity will be of 2%, right? And if there is 2 diopters of difference, the disparity will be 4%. And if there is 3 diopters of unequal refraction or anisometropia, the disparity will be 6%. So some of the research articles says that the children at this age group can tolerate the disparity of 6%, or he can tolerate the difference, or he can tolerate the anisometropia of 3 diopters, right? So we can prescribe full correction in the left eye as well. This is the very important point. Do not undercorrect the power in the fellow eye, right? If there is a difference of 3 diopters, but remember there is a well-renowned book called American Academy. That book says that if the anisometropia in the both eye is 4 diopters, in this case you can prescribe full correction as well, right? So remember that the children or the kids can tolerate the anisometropia more appropriate way as compared to the adults. So that patient is of 6 years, right? 6 years or 5 years kind of, right? The children can tolerate the anisometropic effects more appropriately than the adults. So again, this is very important. You can note it down: the power, the difference in the power or anisometropia, and disparity. 0.25 of disparity, 0.5. Disparity is always double to the power, right? So let's discuss another scenario. And now the prescription is the same, +1 in the right with 0.5 cylinder, +3 in the left with 0.5 cylinder. The prescription is the same as in the last scenario, but the visual acuity in the right eye is 6/6 is the same, and in the left eye is 6/12. The aided visual acuity, the visual acuity with prescription in the right eye is 6/6. The visual acuity in the left eye with prescription is 6/12. So it means that the patient has already got amblyopia, and that amblyopia is due to anisometropia. So this is actually the anisometropic amblyopia. So for example, a patient visits your clinic, right, with +1 sapphire with -0.5 cylinder at 90 degree and +3 with 0.5 cylinder at 90 degree, and the visual acuity in the right eye was 6/6 and then left eye was 6/12, and you diagnosed that the patient is of anisometropic amblyopia, right? So how can we manage this patient? How can we treat this patient of anisometropic amblyopia? So actually there are two modes of treatment for this. The one treatment is for amblyopia and the other treatment is for anisometropic amblyopia. So again we will find the dominant eye, and you know very well that what is the dominant eye actually. So the right eye is actually the dominant eye. Why dominant eye? Because it got least prescription with maximum visual acuity, right? So this is the dominant eye, and remember we will always prescribe full correction in the dominant eye. So we will prescribe the full correction in the dominant eye, and we will get the maximum visual acuity 6/6, 20/20 in the dominant eye, which is right eye, right? And in the left eye, what about the left eye? Now we cannot undercorrect the prescription because patient is already amblyopic. We cannot put the undercorrected prescription in the amblyopic eye, right? So what will we do? We will prescribe the full correction as the patient of the age of the patient is 6 years. So we know very well that we can prescribe the full correction. Patient can tolerate it easily, right? If there is a difference of +4 or -4 in the both eyes, the patient can tolerate very easily, very appropriately, right? So we can prescribe the full correction. So when we prescribe the full correction, we treat the anisometropia, and now we will treat anisometropic amblyopia. And for that purpose, for anisometropic amblyopia, we will go for patching, right? We will patch the eye. And which eye? Remember that in amblyopia treatment, we will always patch, we will always occlude the better eye. So what is which one is the better eye? The right eye. We will patch the better eye, the right eye. For example, this is right eye, this is left eye. So this is normal eye, and this is lazy or amblyopic eye. So we will occlude, we will patch this normal eye, right? We have prescribed full correction in the right eye because why reason? Because this is the dominant eye, and we have prescribed maximum prescription, which is +3 with 0.5 cylinder at 90 degree. Leave it if the visual acuity is 6/12, doesn't matter. You have to prescribe the full correction, right, to prevent amblyopia, right? So we have prescribed full correction in the both eyes. Visual acuity is 6/6, and to treat the amblyopia, we have patched the normal eye, right? So patient can see maximum with the lazy eye, with the amblyopic eye, right? So we can initiate the power in the amblyopic eye or lazy eye, right? So we have prescribed maximum correction, and at first week of patching, first week, we will patch the amblyopic eye for 3 hours, and in the second, we will patch the amblyoptic eye for 4 hours, right? And in the third week, we'll patch the eye for 6 hours. because the patient is not habitual for the patching and he or she is the kid, right? So at first week, you will prescribe the patch in the amblyopic eye for 3 hours, second week 4 hours, third week 6 hours. And after these weeks, you will call the patient again and you will check the visual acuity, either it is improving or not, right? So this is how you can improve the vision in the lazy eye or amblyopic eye with the help of the patching, with the help of the occlusion. And now let's discuss another scenario. For example, after refraction you got the prescription in the right eye is -2 with 0.5 cylinder at 90 degree. This is a supposed value of supposed prescription, and the acuity in the the prescription in the left eye is -9 sapphire with 0.5 cylinder at 90 degree. This is actually the prescription of my friend, right? So my friend got prescription in the right eye which is -2 with 0.5 cylinder at 90 degree, and in his left eye he got prescription of -9 spherical with 0.5 cylinder at 90 degree, and the visual acuity in this eye is 6/6 in the right eye because the right eye got least prescription, so acuity is 6/6, right? And in the left eye the visual acuity with prescription is 6/60. Look at the prescription with -9 and 0.5 cylinder at 90 degree. The visual acuity is 6/36. 6/36. So we can already see that the patient is of anisometropia, and aided visual acuity is 6/36. So it is proved that the patient is of anisometropic amblyopia. So what is the mode of treatment in that kind of patient, in that sort of patient? So again, we will prescribe full correction in the right eye, and you know it, you know why, you know very well that why we must prescribe full correction in the right eye, because this is dominant eye and dominant eye got 6/6 vision, so we have to prescribe full correction to get the maximum visual acuity in the right eye, right? And now left eye got -9 sapphire with 0.5 cylinder at 90 degree, and acuity after the prescription is 6/36, right? So we have to treat anisometropia, and we have to treat amblyopia, right? So first we will, and for example, if you prescribe, for example, suppose this patient is KHURRAM, right? And I got right eye prescription is -2 with 0.5 cylinder and acuity is 6/6, and in my left eye the optometrist prescribed -9 with 0.5 cylinder at 90 degree. So in right eye I got -2 with 0.5 cylinder, and in the left eye I got -9 with 0.5 cylinder, and acuity in my right eye is 6/6. I can see with lenses the acuity is 6/6. I can read the whole chart, I can read the whole logmar, I can read the whole Snellen chart. But when I see with my left eye, which is having prescription of -9, I can only read 2 lines of Snellen chart. Acuity is 6/36. And when occluder is removed, there is severe diplopia, there is severe disparity, there is almost no aniffusion. So I am feeling symptoms of diplopia, I am feeling symptoms of disparity, I am feeling symptomatic diplopia, right? So how can we reduce that symptoms of diplopia or disparity? So remember that there are 2 different mode of treatments in this kind of patient. We have to prescribe 2 pair of glasses in that kind of patients, right? So here I can write first mode of treatment. Actually my writing is very sweet, you can see. So first mode of treatment, and this is second mode of treatment. Sometimes I can read my own writing. So this is first mode of treatment and this is second mode of treatment. So this is first mode of treatment and this is second mode of treatment, right? In first mode of treatment, we will prescribe full correction in right eye. We will prescribe full correction in the right eye. And what about the left eye? These glasses we are prescribing in first mode of treatment. These glasses are the permanent glasses for that patient, right? He will put that glasses every time, right? So in the right eye, we prescribed full correction -2 with 0.5 cylinder at 90 degree, and in the left eye, we will prescribe the actual number is -9, but we will prescribe under correct number, and we can prescribe almost, this is -2 and we can prescribe minus, you can say 3 or 3.5. So I am prescribing -3 with 0.5 cylinder at 90 degree. So you must have a question in your mind that why I prescribe full correction in right eye and why I undercorrect this prescription. Because patient have to wear these glasses every time. So he cannot face diplopia. He cannot tolerate diplopia every time. He will feel headache. He will feel diplopia, right? So I cannot, being a good optometrist, being actually the best optometrist, you should not prescribe full correction in this situation. If there is a gap of, there is a greater gap between the two prescriptions, between the two eyes, right? So you prescribe full correction in the right eye and you prescribe under correction in the left eye, and slowly and progressively in his next visit you will slowly and progressively will increase the prescription in the left eye, in the amblyopia eye. So these pair of glasses in which we prescribe -2 with 0.5 cylinder at 90 degree in right eye and -3 with 0.5 cylinder at 90 degree in the left eye. So these glasses, these pair of glasses is for every time, right? And this is the treatment actually of anisometropia, because this is our responsibility to make our patient comfortable with the glasses. And now we are discussing about the second mode of treatment, and in this mode of treatment we are actually treating the amblyopia, right? Because our patient is of severe anisometropic amblyopic, right? So in the right eye, again full correction, and visual acuity in the right eye 6/6, and in the left eye we will prescribe the full correction as well, full correction in left eye, full correction in right eye, full correction in left eye. So we are dispensing a new pair of glasses to treat amblyopia in this case, right? So full correction in the right eye and full correction in the left eye. In the left eye we will prescribe -9 with 0.5 cylinder at 90 degree, right? Why? And in this prescription is for the treatment of amblyopia, right? And if you are going to treat amblyopia, you will have to patch the one eye. And which eye? The better eye. So better eye is right eye, so we will patch. This is right eye, this is left eye, so we will patch the right eye, and left eye, amblyopic eye or lazy eye, is opened, right? And we will prescribe full correction in the amblyopic eye. And these glasses are for the amblyopic therapy. And what are the timings of the amblyopic therapy? The same. In first week, the patching will be of 3 hours. Second week 4 hours. Third week 6 hours, which is actually called somehow called the full-time patching. And the improvement in the amblyopic eye strongly depend upon the compliance of the patient. If your patient is following your instructions, the visual acuity will improve, right? Otherwise, if there is no any compliance between you and your patients, the visual acuity will not improve, right? So this matter depends upon of your optometric skills, your training, right? If you are counseling your patients in a very appropriate way, in very professional way, then your patient will follow your instructions. But if you are just prescribing, and if you are saying put your full correction in the right eye and put your least correction in the left eye, and you give your prescription card to the patient, and he will try or maybe not. But remember that this amblyoptic treatment only on depends upon your counseling skills or your communication skills, how you deliver the mode of treatment to your patient. And now we will discuss about in what type of activities, in what sort of activities you will prescribe your patient with amblyoptic glasses, right? In the indoor activities, like if your patient, the working hours or the amblyoptic hours must be active hours, right? Your patient, you will counsel your patient that he or she have to wear the amblyoptic glasses when she is with or he is under his active hours, right? For example, if he or she is reading books, if he or she is writing something, if he or she is watching TV, tabs, or mobiles, and in outdoor activities, if he or she is playing something, like if he or she is playing cricket or something, etc., right? In outdoor activities. But remember, do not counsel your patient that he or she can drive with amblyoptic glasses. Then you will be responsible for that. So that was all about the anisometropia. We have discussed the definition, we have discussed the different types, we have discussed the different clinical importance of anisometropia, and we have also discussed the mode of treatment of anisometropia and anisometropic amblyopia. We'll see you in the next videos.